Hi, everyone. Welcome. Today, we're diving into a fascinating and crucial topic: Autism Spectrum Disorder, or ASD. I'm excited to have you here as we explore this important subject together. If you're following along with the course outline, make sure to refer to your uploaded document for additional context. So, let's begin with understanding what autism spectrum disorder actually is. Autism is a complex developmental condition that affects how a person thinks, interacts, and communicates with others. The spectrum part of the name indicates that there's a wide range of symptoms and levels of support needed, making each person's experience with autism unique and different. Did you know that autism affects people worldwide across all ethnic and all socioeconomic type groups? Currently, it's estimated that 1 in 54 children is diagnosed with ASD in the United States. This prevalence highlights the importance of understanding autism more deeply so we can support those affected by it and so we can foster a more inclusive society that's understanding and caring. Now, let's look at the symptoms associated with autism. Core symptoms include things like social communication difficulties and restricted repetitive type behaviors. Individuals on the spectrum may find it challenging to express themselves through spoken words or understand social cues in conversations. Similarly, they might engage in repetitive actions or have specific routines that they follow strictly, which sometimes as parents can get a little monotonous. However, it's key to remember that there is a significant variability in these symptoms. So, some people with autism might be very high functioning with very subtle signs, while others might require more substantial support. Furthermore, symptoms can change with age, bringing new challenges or improvements. Let's talk about the communication challenges that are faced by individuals with autism. Many experience verbal communication difficulties, such as delayed speech development or a tendency to repeat phrases. This is a phenomenon known as echolalia. On the other hand, nonverbal communication is also an area that can pose challenges, with difficulty in using gestures, reading facial expressions, or just plain understanding social cues. So, how do we provide support? Well, there's speech therapy and alternative communication methods like augmentative and alternative communication devices, AAC. They can be incredibly beneficial in helping individuals find their voice and connect with others more effectively. Low method AAC can be just picture exchange. Sensory processing issues are another aspect many individuals with autism experience. They might be overly sensitive to sensations. So think of loud noises or bright lights or under responsive, not reacting typically to sensory input. So common sensory challenges include sensitivities in that auditory world, visual, tactile, and proprioceptive type systems. But there are ways to cope. Sensory diets are tailored to an individual's needs and environmental modifications, and they can make a big difference in managing these sensitivities. Behavioral aspects are also important to understand when talking about children with autism. Some behaviors associated with autism can include things like repetitive actions, such as hand flapping or rocking, while others might have specific routines or rituals that provide them with a sense of structure. Emotional regulation can be difficult, often leading to meltdowns or shutdowns. Strategies for managing emotions might include creating calming routines and calming environments. But let's not forget the strengths and special interests individuals with autism often possess. By focusing on their unique skills and encouraging hobbies and talents, we can help them thrive and we can even teach them through those hobbies and talents. Now, turning our attention to treatment options. While there is no cure for autism, many treatments can help manage symptoms. Medications are sometimes used, particularly for co occurring conditions like anxiety or ADHD. However, these come with considerations of side effects, making it crucial to have a personalized treatment approach and making sure you are connected well with your doctor and trust them. Behavioral interventions like applied behavioral analysis, which is ABA, or cognitive behavioral therapy, CBT, are common, but the key is a tailored plan that fits your child's unique individual needs, ideally developed in collaboration with healthcare providers. In conclusion, awareness and support are the foundation of making a positive impact on the lives of those with autism. With ongoing research and advocacy, the future holds promise for even better understanding and support strategies. Thank you for joining me on this journey to learn more about the autism spectrum disorder, and stay tuned for further lessons in this series.